section. Okay, let's discuss the common carotid artery. Let me move back to the 3D model, then I will summarize right here. If we look at the common carotid artery, I'm showing on the right side, left side. On the left side, it is an independent branch of the arch of the aorta. Let's add the things to our picture. And let's add also brachiocephalic trunk. And let us also add a right common carotid. I'm using, by the way, 3D for medical anatomy, and a right subclavian artery. Okay, then let's look at these things as we will be able to see. If we look at from the right side first, we will see here. Here you can see the arch of aorta. If you look inside, this structure will be the arch of aorta. On the right side, there is a common artery that is known as brachiocephalic trunk. And if you look in the anatomical position, just behind the joint between the sternum and the clavicle, sternoclavicular joint, just behind that point, it divides into two. It divides into the subclavian trunk that is going to the above the upper limb, above the first rib to the upper limb, and this is the common carotid artery. So this is the origin of the common carotid arteries on the right side, origin and termination. The things that you have to remember, it is arising from brachiocephalic trunk, and it is dividing and it is ending. There are two points at which it can bifurcate, it is not exactly easy to pinpoint one point. You sometimes it is written at the hyoid cartilage, hyoid bone, and sometimes it is written at the upper end of the thyroid cartilage. Both of these are correct because there is a variation between the two. You just have to remember the root values, the vertebral column values, the vertebral values, like it is at the level of C3 and it is at the level of C4. So when you're talking, you should at least match your discussion with the vertebral level. So if you say that common carotid artery divides at the level of thyroid cartilage, at the upper level of the thyroid cartilage, you have to mention that it is at the level of fourth thoracic vertebra, fourth cervical vertebra. But if you mention that it is dividing at the level of the hyoid bone, you have to mention the C3. Both of these are correct because here is a natural variation, but you have to just keep in mind that whatever you are speaking, you just maintain a consistency between the two. On the left side, you can see, let us hide these for now. Okay, the arch of aorta, it has a separate, on the left side, there is a separate origin of left subclavian artery and the common carotid artery. They both move upwards above the neck. They are on the left side of the trachea, and as they come up, okay, let me hide it back again. As they come up, and they separate from one another, they diverge from one another, and if you look at the anatomical position, you can see that they are again diverging at the same level behind the sternoclavicular joint. So they may not be coming from the same origin, but you will see them diverging from the same point. So this is about the origin, and the terminating part on the left side is also the same. It can be considered at the upper level of the thyroid cartilage. It can be considered, here it is shown in between the two. It can be considered upper level of thyroid cartilage and can be considered between the hyoid bone, but you should remember the levels of the two. So you should, description should match where you are describing the bifurcation. So this is common carotid artery, and okay, and this is how you actually define its surface anatomy also. Let me get the Mr. Surface. Okay. So if you have to mark the subclavian artery, the common carotid artery on the surface, what you do is you palpate these regions. You palpate the sternoclavicular joint and you draw a vertical line upwards. And there you find the upper level of the thyroid cartilage. And this is basically the root of the common carotid artery. It is behind this line. Let's try to find out how accurate I was. If we look at almost, you can see that the common carotid artery is behind this. And the interesting thing is that it has a pulsatile nature, so it can help you find out a little variation, that the deviation from the normal pathway. Okay, here the common carotid artery, it is dividing into the external carotid artery and the internal carotid artery. But here is one interesting thing that you can see right here. Just near the origin of the common carotid artery, it is having a swollen structure. Here the wall is swollen like a balloon, and this is called carotid sinus. This is called carotid sinus. This is basically the baroreceptor. It baroreceptor mean it senses the changes in pressure. So any raise in blood pressure or the fall in blood pressure, it is detected by this point, and it gives the signal to the autonomic nervous system to change the blood pressure accordingly. And this is supplied by the carotid branch of vagus nerve. There is the nerve that supplies it. So this is about the carotid sinus. And there is also another interesting structure that is known as carotid body. Let me get that into the model. Between the two bifurcation point, just in front of the sinus, here this structure is known as carotid body. This is the structure that has a chemoreceptor function. It is a pair of arteries, glomus arteries, that are coming to it, and it continuously senses, takes sample from the it continuously takes sample from the blood for the oxygenation level. So this is what we talked about till now. The origin point behind sternoclavicular joint, the termination point at the level of thyroid cartilage. But I added to this, in addition to the thyroid cartilage, it may be, or hyoid bone can also be. This can be a correct answer also. In this particular picture, it is shown at the level of the thyroid cartilage. The carotid sinus, the vagus nerve is present between the two. The internal jugular vein is laterally. We will see the relations just shortly. The carotid sinus has a baroreceptor function. It is present here. It is supplied by the glossopharyngeal nerve, and the carotid body is just in front of it, right here. And it has a chemoreceptor function. It detects carbon dioxide. What are the relations? What are the structures that are related to it in a different views? Okay, what structure is behind it? Let me. Okay, what structure is behind it? Behind it, in this particular picture, you can see the muscles that are present behind it. The muscles that are present behind are the scalenus group of muscles. So there is scalenus anterior at the upper end, and as we go on, this is the scalenus anterior. Behind that, there is also sympathetic trunk. Let me show you right here. Let's add. Let's add sympathetic trunk here. Oh, sorry, left side. On the left side. Okay. So you can see the common carotid artery. It is posteriorly related to this muscle, the scalenus anterior. It is posteriorly related to the sympathetic trunk that is behind it, and behind it, through the scalenus, indirectly it is linked to the transverse processes of the cervical vertebra. Let me get the book also open. Give me 1 second. Okay, so we were talking about the relations here. So this is about the posterior relations. Moving on, the front, anterior relations, anterolateral relations. Basically, on the front, you can see that on the other aspect, it is originating from behind the. It is passing through the root of the neck. So all of the muscles that are in front of the root of the neck. So here the infrahyoid group of muscles, the sternocleidomastoid, all of these that will be in front of it will be visible right here. Okay. And there's a middle thyroid vein that is passing in front of it also. Medially, on the medial aspect, you can see that there is trachea and larynx and trachea. If we enteromedially, if we look at its trachea and larynx, just behind the trachea and larynx, obviously there will be pharynx and esophagus. So these are the structures that are related to it medially, and between these structures there is running of the recurrent laryngeal nerve. And on the medial aspect there is thyroid gland also. So this is about the common carotid artery. Apart from the two terminal branches, there are no other branches of the common carotid artery apart from this internal and external